I also scared because sometimes this sickness lead to death. Both my children have malaria.
One la picnic ni po mintai pasya this land na stop na dihatin din stop. Bisa wari dong em sai waka para samone em sa pani samone em sa close samone na stop na dihatin din bo stop.
Most of the kids here, small kids, mostly under 5 years of age, they got signs of malnutrition. When they got malaria, it's life-threatening to them. It's very, very hard to get to the villages by boat, by car, and also by foot. By walking, it takes almost 2 days to reach a place. My name is Waipeli. I work for PSI. I've trained the community-based distributors. People are still living in traditional way of living. They don't have any access for electrical supply. Along the Papua River, they don't have any health services. They depend on our CBDs. We are heading straight to the incomplete house, Marasino. The CBDs work in the village here, test people who comes with signs and symptoms of malaria and give them treatment. Kesta tating you to know that now?
Yeah,
One time straight you run out. March. Low March na kami na tayo Marasin finish, yogum one. You yogum samblas, wogosam, you segem bluetooth, lakay no. You stop natin.
Lamat sekama sa mi minopit sege
Lula mina total.
minopin sege mol sigmangan mi stop natin.
The biggest problem to the CBD is when the CBD runs out of drugs, it cannot do much or it cannot do nothing at all. All this supplement of the drug should be given by the National Department of Health with the assistance of the health post and the health centers.
In these remote communities, when the health authorities fail to deliver supplies, villagers can go months without getting any treatment. And it is the children, especially those under 5, who are most at risk at being infected by malaria. The Population Services International team, who are funded by the Global Fund, take some drugs and testing kits with them when they visit the community-based distributors or CBDs so that they can give them extra training and ensure they are using them correctly.
Tamil lugu masal di sa sani pinis na mi wo film masan mi wari di lo help mol sigman. Na mi try lo rugi lo gisimal titi as all this something Marasin. Mi lugu masal mi hado mi lugu gisim tu. Mi try mi go lo help post or help me too much too.
Nim lo me marina. Nim lo mastap lo me timon. Picnic gate lo me siwa. Time siki kisi mi pla sa trome pul kolo piflo. Kami pla kolo piflo. Tapos kutla light Marasin em kipi mi pla. Em kipi picnic lo me paista. Tapos em kipi lon Marasin em mindai. Plan di tru ya. Plan di tru. Pain na blokantim. Tupla indai finish. Okay, naik at 5 la taharista, 2 la picnic ni mana, 4 la picnic ni Mary. Minus sa la itai plongen. Picnic plongen ya, nampon tayo mindaya. Mitu minasa. Mok la hari-hari aptasan. Mok la hari-hari aptasan. Kata. Minus sa. Mari dia o. Ini plan asawe. Oris la musketane tia. Tami pla pluke na taiti na silip. Mi pla no film tu. Musketa walk le kam site.
One of PSI's roles has been to get people to sleep under the treated mosquito nets, and this change in behaviour has seen rates of infection dramatically reduce, especially as nets are being distributed across the whole country by Rotarians Against Malaria, who are also funded by the Global Fund.
Well, we should be distributing about 30,000 nets, which is all the children under 5, and hopefully if we do this, we basically supply nets to about 40% of the population in Leh, because each of the nets that we give out is enough to sleep 3 people, so it's not just for the children, it's also for their brothers and sisters, and in some cases their parents as well. So how many people did you see today? 10, 20, 30, 40, 50. Well, we've been practically to every single village in the country. Around about, we should have over 95% coverage of the country, if not more. So on paper at least, we have reached practically every single village, which is about over 20,000 villages in PNG. So the net itself costs around about $3 or $3.25 to get into PNG, and then there's another $3 in administrative costs. But if you look at the private sector, for instance, you go to shops, we are actually distributing the nets for a lower cost than what most shops will sell them for here in the country. It has been a huge success, both programmatically and against malaria, because malaria is now reduced by about 70% in the last 5 years.
In 2009, Papua New Guinea was the largest recipient of Global Fund investments for malaria outside of sub-Saharan Africa. But the National Department of Health, which was receiving the money, was unable to provide accurate data as to where it was being spent. The government also admits it struggled to deliver the nets. As a result, the government voluntarily stepped down as a recipient of Global Fund money, and instead the grants went direct to NGOs, including Population Services International and Rotarians Against Malaria. The government, though, is still responsible for buying and distributing the drugs, but the supply chain often breaks down, leaving some remote communities without drugs for weeks at a time.
We cannot blame one component. There is so many different components in the chain. It has been well documented that after Global Fund had an audit team here, they found out that our finances, we were not able to manage the finances in the way that they would have expected. Distribution of mosquito nets requires a lot of logistical issues.
We are now at Bifro. We are going to meet with the health staff and see the aid post. Lo pasta ilu ko sana malaria mo kontap o no lo now time on the album lo line ya come inside ilu ko sana malaria come down no malaria still staban tap.
Okay, in a bishim this a mosquito net and malaria been rise. Okay, timely supply in this la mosquito net. Now you go want them a malaria treatment. Mirukimasem, Emirudisim, a number of malaria come down.
We've had a huge reduction in the prevalence of malaria in the last 5 years, and that can only be attributed to the nets, because we were very slow to roll out the new treatment program, and even now there's a problem with drug supply. From the prevention side, we're doing really well, and we've had a massive, it's thought about 70% reduction in the prevalence, which by any standard is a terrific achievement.
2 weeks ago, my kid had a malaria positive 9 over 100. So when I heard that the malaria team people came and gave out nets, I was happy that I should go and get 1 net for my kids. I went. When we stay outside, mosquito will bite us, but when we came inside, I'm happy that this net will protect me and my son from malaria.
Mothers and children are those, they are very vulnerable group of people to get malaria attack. Women mostly, they go through pregnancy and all these things, their body changes and their immune system is low. And we have mosquitoes who bring malaria just residing around our area. So they are very vulnerable.
Across the whole country, levels of malaria infection and mortality have declined dramatically since RAM and PSI started work. But in the most recent round of funding, the Global Fund reduced investments by 45% across the country. It means Rotarians Against Malaria can no longer give nets to everyone.
Unfortunately, the Global Fund cut our budget, so we had to re-strategise the way we do things. We are hoping that the under 5 distributions are still enough to maintain malaria control, and if it doesn't, by doing this strategy, it means that if we do have a problem with malaria in Ley, it's an easily accessible place and it's very easy to pump resources in here. But if we were to do this kind of strategy somewhere in a very high malarial area, which is remote, it would be very, very difficult to respond to any outbreak that's occurred.
We started 5 years ago working in those 3 provinces, which were the one with the highest prevalence of malaria, but after 5 years the trend has changed across the country. There are other provinces which are now in much higher needs, like New Ireland, like West New Britain, like even Bougainville. But without the funds to roll out the program, it won't be possible to intervene.
The problem is we started on a journey. We started on a journey to try and eliminate or eradicate malaria in these places. And one of the consequences are, by having a reduction of 70% malaria, we've actually wiped out immunity to the disease. So if it comes back, it's not only likely to come back in the same degree as what it was, it's likely to come back even worse because everybody will be affected.
This has been noticed way back in the eradication days, when the indoor residual spraying actually reduced malaria cases to very low levels, and when it stopped, then the resurgence was very quick and it came all over the country. So it can happen again.
Without the Global Fund program, we would have a great problem, and I'm sure we would have an increase in the burden of disease very quickly too. The government is not ready to take over, and I'm afraid we will need donor support for some time to come.
The malaria program in Papua New Guinea has been hugely successful. We are very confident that the Global Fund will continue to receive strong support from its partners, and that will allow us to keep Papua New Guinea as a priority country within the Global Fund. I do foresee a time where there will be an increased funding commitment from the government of Papua New Guinea, but that doesn't mean that we would be leaving anytime soon. I mean, we are there to stay.
Malaria is an underlying cause for much of the disease burdens we have in the country. If we were able to get the levels of funding that we enjoy at the moment through Global Fund, I am very, very sure that we could keep up this momentum, and we could actually really push out malaria in communities throughout the country.
There's been a great impact. They help to improve the lives of the people. If funding stops, we will face another problem, and that would be a very big problem.